disease COVID-19 is an infectious disease caused by severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. Most patients infected with the virus will have mild to severe respiratory illness. People over the age of 65, as well as those with underlying medical disorders such as chronic respiratory disease or cancer, are at a higher risk of developing a serious illness. During the initial outbreak in Wuhan, the virus and disease were commonly referred to as coronavirus. WHO finalized the official names COVID-19 and SARS-CoV-2 on 11 February 2020. Director General of WHO explained C for corona, V for virus, D for disease, and 19 for when the outbreak was first identified. SARS-CoV-2 is a virus that shares similarity with bad coronaviruses, pangolin coronaviruses, and SARS-CoV. The first reported epidemic began in November 2019 in Wuhan, Hubei, China. The scientific community agrees that the virus is most likely zoonotic, originating in bat or another closely related mammal. Controversies concerning the virus's origin increased geopolitical tensions, particularly between the United States and China. The first Malaysia was confirmed with COVID-19 on the 4th February 2020. The 41-year-old man had returned from Singapore when he started to develop a fever and a cold. He was quarantined at Hospital Sungai Buloh, Selangor. A 40-year-old female Malaysian was reported positive for COVID-19 on the 6th February 2020. She was the first COVID-19 patient in Malaysia who contracted the virus via local transmission.
And now we are moving on to how COVID-19 spreads. COVID-19 spreads between people in close contact with each other and is easily transmitted in crowded settings. Closed space with little or no ventilation or prolonged contact with an infected person, as the infected person with this virus breathes, talks, coughs, or even sneezes. Liquid particles are expelled into the air. Larger particles are known as droplets, meanwhile smaller ones known as aerosols. You can get infected if the virus in aerosol or droplets come into contact with your eyes, nose, or mouth. Always maintain a physical distance for at least 1 meter from each other, regardless where you are. When in an enclosed space, open the windows or door for a good ventilation, since aerosol or droplets contaminated with the virus can remain suspended in the air or travel up to 1 meter. Wear masks as the prevention and control. Limit your time spent in these kinds of settings.
Let's move on to the impact of COVID on human health as well as the treatment that could be done to fight against the virus. The COVID virus can multiply and adhere to various surfaces and last for several days. It primarily spreads to the air when someone's coughing or sneezing, and you may become infected by touching your face, following contact with an infected person, or touching contaminated surfaces. The virus starts to invade the respiratory system and moves to the intestine, spleen, and the most common cancer is the lung, where it will cause much severe condition for the patient. As the patient has been exposed to the virus, the number of infected cells increases rapidly as billions of viruses multiply actively in the body cells. Fortunately, the body's immune cells will be activated and migrate to the site of infection as the response to the invaders. However, the coronavirus have the ability to infect them and cause them to overreact and lead to an unnecessarily large amount of immune cells at the site of infection, which later will damage not only the infected cells but other healthy cells as well. A health condition related to the lung will occur as a result of the tissue damage in the lungs. The damaged tissue may take a long time to heal even after the patient has recovered from COVID. A person suffered from COVID may face a few other conditions such as fever and dry cough. In some other cases, it may lead to breathing difficulties where the need of ventilators is vital. Fatality might also occur in a much later stage. COVID are considered as pandemic in the early days and it spreads rapidly from one person to another. There are not enough medical supplies to handle the outbreak in a controlled manner. Healthcare staff also pose the risk of becoming infected with the virus. Thankfully, the development of vaccine against coronavirus assists in the prevention of COVID-19 in a large scale. The mortality rate has also been decreased as the vaccine can reduce the severity of the illness. Even if a person is infected with the virus, they will only bear a mild fever which can be tackled down with the intake of painkiller or paracetamol. As for the symptoms like coughing, sore throat or runny nose, the cough medicine and anti-allergy medicine should be enough.
Impacts of COVID-19 generally in Malaysia. Okay, so COVID-19 was declared by the World Health Organization in March 11, 2020. And this outbreak has led to a very big impact on a lot of aspects in Malaysia. Alright, so the first one is inadequate numbers of frontliners. Days by days, the COVID cases has arisen, and consequently, the number of frontliners workers are not enough to treat and take care of all their patients. So this will lead to emotional stress among the frontliners, especially the healthcare workers, when they have to put over 100% in commitment in doing their work for a long period of time, to the point that it will trigger the burnout situations, as they have to adapt to SOP at the same time. So the second one is downfall of economy. COVID-19 outbreaks had also impacted on our social economy, which due to border closures, trade restrictions, and also confinement measures. As an example, on March 19, KLIA in Malaysia was shut down until March 31st, and we suffered losses as much as 45 million ringgit. Also, research shows that within the lockdown, Malaysia had suffered a total of 2.4 billion per day. So the third one is depression due to loss of work. So following the COVID-19 pandemic, a total of more than 140,000 people in Malaysia had lost their job due to a pandemic between March 2020 until August 2021, and this is according to the Human Resources Minister. So the last one is usage of face masks in Malaysia. So due to high COVID-19 outbreak in Malaysia in March 2020, the face masks were only compulsory for frontliners and also those who have the symptoms of the virus. However, the cases started to re-emerge after the MCO, and on July 23rd, it was announced that it is compulsory for everyone to wear masks once they step out of their house.
Treatment for COVID-19 is getting vaccinated. COVID-19 vaccine are effectively protect people from getting seriously ill, being hospitalized, and even dying. Researchers have found that COVID-19 virus begins the process of creating copies by attaching its spike to a host cell. Those spikes offer a target for vaccine. With the right preparation, our immune system can utilize the vulnerability. A vaccine is used to arm our immune system. It contains messenger RNA, which can direct cells to make specific proteins. The messenger RNA tells our cell to produce COVID spikes. These harmless spikes give our immune system the information needed to quickly detect a coronavirus infection and produce the appropriate antibodies. The new antibodies respond once COVID has entered the body. They attach themselves to the spikes on the COVID virus, rendering the spike useless, protecting our cells and keeping the virus from reproducing. In conclusion, it takes a while for the world economy to recover from the contraction. It seems that this pandemic will lead to a permanent shift in the world and its politics, especially in health, security, trade, employment, agriculture, manufacturing goods and production, and science policies. This pandemic has taught us that the entire world is connected. If we do not work together and cooperate, humanity will suffer drastically. We need to implement a few changes so that we not only emerge from this crisis, but are also able to continue with our life in a healthy and sustainable way.